My name is Robert Boykin. I'm one of the orthopedic surgeons with EmergeOrtho. I practice predominantly in Asheville. So after training, I completed 2 subspecialty fellowships. The first was in sports medicine, which is arthroscopic or minimally invasive surgery of the joints and taking care of athletes. That was in Vail, Colorado. My second fellowship was in shoulder surgery at the Alps Surgery Institute in Annecy, France. The first was at the Stedman Clinic in Vail. My specialty in my practice involves all aspects of shoulder surgery. That includes shoulder replacements, as well as taking care of athletic knee injuries and knee surgery. I grew up in a small town in South Carolina, and I was fortunate as a young man to get exposed to 2 wonderful doctors. William Young was a pediatrician in our town, and Phil Brandt was a primary care doctor. These 2 doctors mentored me through high school and showed me what it was like to be a physician in the truest sense. These were doctors who would visit their patients at a nursing home. They admitted all of their patients, and they were the type of doctors that would come by your house and check on you as a patient or a family. And these doctors were instrumental in my desire to become a doctor myself. As an undergrad at the University of North Carolina, I had a chance to be a summer intern at Brigham and Women's Hospital in Boston in the emergency room. And during that summer, I had a chance to see what it was like and the fulfillment the doctors there got from taking care of patients who had an acute injury. That was probably the moment that I decided I wanted to be a physician myself. Life comes full circle. Years later, I would go and serve as an orthopedic resident in Boston at the Brigham and Women's Hospital, as well as the Mass General Hospital. What's unique about Emerge? We're the largest orthopedic practice in North Carolina, one of the top 3 largest orthopedic practices in the country. And what makes Emerge great is the fact that it's physician-owned, physician-led, and physician-run. We are not affiliated with any specific hospital or owned by an outside entity such as private equity. That allows us to be fully independent. So our doctors can choose which hospitals they work at, which facilities they want to go to, and make decisions which are best for the patient. This allows us to deliver high quality, low-cost care, which brings immense value to our community and allows us to be able to take care of patients with best practices across the entire state of North Carolina. I think my favorite part of all about Emerge is the people I get to work with. From our statewide administration to our EmergeOrtho board to the people I work with on a daily basis, we've established a great team. And here that's the mid-level providers, the athletic trainers, the medical assistants, the physical therapists, etc. I've really enjoyed as well getting to work with colleagues and doctors across the state and having friends through Emerge. The biggest impact that I make in the community is taking care of my patients, the patients in Western North Carolina who have musculoskeletal needs. This was never more evident than after Hurricane Helene. Our offices in Asheville were closed. Our doctors all came together in Arden to see any patients that would walk in the door for whatever problems they had. And I must say at that point, I've never been happier to come to clinic and see my patients. I've also never been more grateful to be able to do the job that I do. As a sports medicine provider here in town, we serve our community by providing on-field coverage for athletes as well. I have the opportunity to serve as team physician for the University of North Carolina at Asheville, for Warren Wilson College, and for Asheville High as well. You know, the patients of Asheville are extremely active. We have a mix of young people who enjoy outdoor activities. We also have a mix of retirees who are athletic and active as well. This mentality lends itself to multiple orthopedic injuries, and we're privileged to be able to be here and take care of these patients. As a resident and fellow, I was able to take care of many of the pro sports teams in Boston, the U.S. Olympic ski team, as well as the Spanish Davis Cup tennis team. And it's been fun to take the lessons I learned in treating these elite athletes and be able to apply them to the athletes of all ages of Western North Carolina.